Hi guys, my name is Bruno Correga. It's my project about imaging research pills, and when you talk about one important topic in less than 5 minutes. Today we talk about value-based imaging in COVID-19 patients. I think this is the most important paper. It's a systematic review that I think is in the third updated. He started in 2020, but there is very up-to-date information in this systematic review. Then they found a high risk of bias in almost all papers in diagnostic imaging to perform the diagnosis and also to perform the prognosis of these patients. Then the authors do not recommend the use of imaging as these, and we should ever think about these when they are indicating imaging in these patients. Here is other thing that's very important is that imaging before the day 5, around 50% of patients will not have CT findings. CT findings will be normal, but between the day 5 and then day 15, almost all of these patients will have some findings. Then this is important because the onset of symptoms is very important to prognosis in CT, because if you get CT after the day 15, the prognosis will not be good evaluated by CT findings. But before the day 8, it will be a very good method. And all the papers in the literature show this. The findings grow up until the day 10 or 15, and after this, there is a relief of this CT findings. Well, what do you have in the guidelines? The ACR and BSTI, British Thoracic Society Imaging, and the American College of Radiology recommends against the use of CT as a single screening method to diagnose COVID-19. And they tell that chest CT should be reserved for hospitalized and symptomatic patients with specific clinical indications for CT. Also, the Fleischner Society recommends a baseline imaging in COVID-19 patients with moderate or severe symptoms or with mild symptoms and high risk factors like age, like a previous disease, to try to prognose the clinical worsening. This is a very interesting paper about chest CT in preview the patients that going to ICU unit. And we see the accuracy of CT is around 90% if the patient has more than 50% of extension of disease in CT and the patient is below the day 8. Well, where is the value of imaging in COVID-19 patients? If your patient is asymptomatic, there is no value in imaging. If this patient has suspect of COVID-19 and the symptoms are mild, you could also do no imaging like in children. But if the patient has some risk factors like a COPD, like obesity, like heart failure, you could perform the imaging and ACR and BSTI polarized chest X-ray that has a good indication for prognosis too. I think this is the same, almost the same thing as CT, mostly of the papers. And also the patient have moderate to severe. All the societies indicate imaging could be chest X-ray or CT scan. The England use much more chest X-ray. The United States is using more CTs, but in Brazil also you are using much more CTs than chest X-ray. And when you have a worsening of status, of clinical status, you could use imaging too. And also we should consider DMRD as an indicator for CTPA. And the threshold used in the literature is around 2000. Thank you very much for your attention and see you in the next video.